Thank you for joining us this afternoon for a conversation on back to school health and COVID-19. Today, we're joined by Dr. Max Oren. He's coming to us live from Christiana Care Primary Care at Concord. We're also joined by pediatric infectious disease physician, Dr. Stephen Epps, coming to us from the Center for Women's and Children's Health. Thank you both for taking the time to have such an important conversation today.
Thank you.
Pleasure to be here.
So many students are going back to school in person over the next week or so, and there is a lot to keep in mind, both COVID related and those typical back to school safety questions. If you're watching at home and you have questions, please submit those questions in the comments below, and we will take a look at those and try to answer them throughout our conversation today. So before we dive into the COVID content, let's start with an appointment that families should keep in mind at the start of every school year: physicals. So Dr. Oren, how important is it that students come to you or any of our primary care practices for those yearly physicals?
So I love talking about the physical. I think it's extremely important. It's that one appointment that focuses on the things that really matter: physical health, mental health, growth and development. For kids, it's that opportunity to check in, see how they're doing at the present time, and also to frame their perspective and expectations on things to come. So it really helps set them in where they are in the moment and also sets their future growth.
And is a normal physical different than, say, the physical you need for sports to play football or field hockey in the fall?
The sports physical incorporates everything that you do during a normal physical, but also it includes a couple focused questions and exam parts that focus on the health and safety with sports.
So time of year wise, if you were a spring sport athlete, can you wait until the spring to get your physical? Should you do it all now before school starts? What do you recommend to your patients?
I would recommend getting it all done now before school starts. That way you know that you're on top of your vaccines that you need for the start of school. And I think having that kind of routine, that schedule helps kids get into the frame of mind that, hey, I'm healthy, we're going back to school, I got to get back into a routine. And the physical is a good way to kind of approach that.
You mentioned vaccines. So before we get into the COVID vaccine, let's touch on those vaccines that students need to go to school any year.
So the mandatory vaccines will differ by state, but it's important to note, vaccines are our most important defense against communicable diseases, measles, polio. So it's incredibly important to touch base with your primary care doctor, do your physical, see what vaccines you're due for. And there are mandatory and non-mandatory vaccines. Just because they're non-mandatory doesn't mean that they're not important. So definitely have that open conversation with your provider just to talk about all the vaccines that are recommended. The flu vaccine isn't necessarily mandatory, but it can do a lot to protect kids, adults alike.
And Dr. Epps, why are these vaccines so important?
Well, as Max said, they protect against serious and sometimes deadly infections. I think most people know that at this point. It's interesting that, we're 3.5, 4 months before the pandemic began, we just got over the worst measles epidemic we've had in this country in 30 years. And I'm so glad we did, because immunization rates dropped during the first part of the pandemic because of lockdowns and practices couldn't see patients for a period of time. But just imagine if we were still seeing measles and couldn't give measles vaccine, MMR vaccine, that would have been a double pandemic right there. And as far as influenza, let me just point out that, this year, I don't know anybody can really tell you what to expect as far as influenza activity. We didn't have much last year, and in the Southern Hemisphere, they're not having very much this year. But suppose that we do have flu this year. it looks a lot like COVID, right? So having a primary care practitioner trying to distinguish, is this COVID or is this flu, is problematic. And getting protected against the flu will help the overall functioning of the health system. And as far as schools go, I think it's critically important, because if we start having a lot of febrile respiratory infections in school, is it flu or is it COVID? That's going to be really important. So I would advocate for widespread influenza immunization this year.
Absolutely, which brings us right to that COVID-19 vaccine conversation. The CDC recommends everyone 12 years and older should get the Pfizer COVID-19 vaccine. Talk about the safety of that vaccine in this school age group.
So we know a couple of things. We know during the trials where, tens of thousands of kids were vaccinated, we know what was seen, mostly mild side effects. It's things that are more bothersome than serious, like your arm hurts for a day or two, or you feel fatigued, or you run a low-grade fever. So mostly not serious, and just, maybe some Tylenol or ibuprofen over the counter if you have fever or achiness. But many people go through it with no side effects at all, quite honestly. Post-marketing, after the approval back in May, we learned of one side effect with the Pfizer vaccine that's a little bit alarming, myocarditis. But thankfully, that's rare. It's 0.006% of people who get the vaccine. So it's a pretty low percentage. And most people, even though they have symptoms, their symptoms last only a few days, and most of them get completely better. So all in all, a very safe vaccine, and certainly the benefits far exceed any risks.
Absolutely. But with this school age group, obviously there are probably a lot of parents watching who have children under 12, so who can't be vaccinated right now. What is your message to them about keeping their kids safe, all of the time, not even necessarily in school?
Number one, everybody who's eligible for the vaccine should get it, right? So if parents are worried about their kids, the parents should have the vaccine. Uncle Charlie, if he's going to be visiting, should have the vaccine. Everybody around the kid under 12 who's not yet eligible should be protected in order to protect that child. And beyond widespread vaccination, it would be things that we've gotten used to for the last 18 months, such as consistent and correct wearing of masks for the child, physical distancing insofar as possible, hand hygiene, all those other non-pharmacologic interventions that are so important in mitigating the spread of this virus.
Absolutely. And a few weeks ago, Governor Carney announced that all staff, students, and visitors to K-12 schools and childcare facilities are required to wear face coverings. What do we know about how masks will be protecting those kids and their families?
So at this point, we have considerable experience on how well masks work, and they work really well. But you have to wear them, and you have to wear them right, and you can't, pull them down below your nose or what have you. But in the healthcare setting where I work, we know that if you do this correctly, you have a high degree of protection from people who have COVID. We would expect the same in children who are wearing masks. Again, they have to do it right, and they have to do it all the time, or as much of the time as possible.
And Dr. Oren, I'm sure you've seen pediatric patients who may now be going into in-person school for the first time, aren't wearing the masks that often. What do you say to parents about how to encourage their children to properly wear those masks?
As with any conversation with kids, you have to have an open discussion. It's got to go two ways. It's got to be age appropriate, and it's got to be honest. So in an age appropriate way, telling them what's going on in the world and how wearing a mask can adequately protect them. The other thing is emulating the behavior that you want your kids to adopt. So if you're going to tell them to wear masks, you have to do the same thing.
If I could interject, I totally agree with that, Max. So you have to be a good role model, a good example. The other thing I want to just mention is all masks are not created equal. The ear loop medical masks that Max and I have been wearing, and many in the community have been wearing, are the ones that are, provide the best protection. Most people will not need to use an N95, even though I see people doing it. In order for that to be effective, you really have to get fit tested or seal tested, which most people don't go to the trouble of doing. But let me caution people against using gaiters, even though they're popular, and bandanas. They just don't work that well. Stick with the medical grade masks if you have access to them.
And we do have our first comment from the public. Brenda's asking, what are you doing in Delaware for treatment of COVID? So Dr. Epps, just briefly, maybe you could give an overview of what things look like at Christiana Care right now.
Okay, high level overview. Well, first of all, there are no great outpatient treatments for COVID. There's no magic pill that you can take that will stop it in its tracks. For people who are at high risk of developing serious disease, who are symptomatic with COVID, and in the first few days, we do have monoclonal antibodies. I think most people have heard of those at this point, and they're given as combinations of monoclonal antibodies, usually as an infusion, although there's some experience giving them with subcutaneous injections as well. But we have an infusion center here at Christiana Care where we've infused, I think, close to 700 individuals, mostly adults, mostly older adults or those with significant comorbid conditions, but we've done some kids as well. So that is one. And that has been shown to prevent hospitalization, prevent death to an impressive extent. So that's something that can be done in the community. Then, if you talk about treatment of COVID, it's inpatient, and that requires supportive care, of course, oxygen, because many patients will not have enough oxygen, breathing room air. And then there are antiviral medications, such as remdesivir, and there are all kinds of other anti-inflammatory medications that are typically used in the management of these patients. And then if you want to go further, you can talk about the thrombotic complications and how we manage those, and that gets fairly technical. But there's a lot more we can do about it in August of 2021 than what we could provide in March of 2020.
Absolutely. But our main message right now is for everyone to get that vaccine.
Absolutely.
Absolutely.
So as we continue to talk about kids getting ready to go back to school in the next couple of days, nutrition is something that every year we try to talk about, making sure that kids are packing that healthy lunch and are having the correct snacks and are being fully ready to go into school. Dr. Oren, how do we make sure that that's happening? What is considered a good lunch?
So meals are the fuel that we need to keep our mind and bodies healthy. They should be regular, they should be healthy meals, and that's important to give us the energy that we need to perform our best. They should be focused on unprocessed foods, fiber-rich foods, fruits, vegetables, whole grains, generally being the core of what you're eating.
And Dr. Epps, if there are kids in the lunchroom, how are those kids staying COVID safe while being able to interact with their friends?
That's a great question. And, I'll just give an example. Here at the hospital, when we have workplace exposures and people getting COVID in the workplace, it's often, in fact, the majority of the time, it is in break rooms where people have to take off their masks in order to eat and drink. So I'll give the same advice that I give here in the hospital, which is if you have the ability to have your lunch outside, and many schools do, that would be great, because outside it's much harder to transmit COVID from one person to another. So outside, snacks, outside lunches would be great. Otherwise, we're left with, physical distancing. Try to stay 6 feet apart when you have your mask off. Have your mask off for the minimum of time that's required in order to actually shovel the food into your face and to drink your drink, and then put it back on. And obviously, the other things like hand hygiene before you eat.
Thank you. Let's now transition to backpacks. There's students who have been virtual, maybe haven't had to put a backpack on and get on that bus in over a year. So Dr. Oren, what is important to keep in mind when choosing a backpack and putting things into that backpack?
So backpacks are important to talk about just because there can be a lot of weight in a backpack. It can introduce a lot of stress, cause back pains. And so it's good to do preventive things to avoid that. The backpack should distribute the weight over the major muscles of the body. It should be even, so having 2 straps, wide straps, being able to adjust it easily to have it close to your back. The bottom of the backpack should be 2 inches above the waist. Sometimes having a waist strap can be helpful. Will all help distribute that weight of the backpack over your major muscles and prevent injury. Weight of the backpack should generally be less than 20% of your body weight. So also keeping that in mind, trying to put as many things in lockers as possible so you're not walking around all day with a heavy backpack.
And Dr. Epps, families concerned that all of the school supplies, the backpack that are going from home to school and back again, may be the perfect way to transmit all, even COVID. So what is your recommendation for keeping all of that clean?
Well, back at the beginning of the pandemic, I think people were much more worried about inanimate objects and COVID living on surfaces. And that can certainly happen. But most COVID is transmitted through the air and respiratory droplets where the viruses, go from one person to another. And the role of inanimate objects or surfaces is probably much less than we originally thought. Having said that, this is an easy virus to kill. You can use most standard disinfectants do a good job, and most of them now have COVID on their label if they are suitable for COVID. And so simply spraying a rag and wiping surfaces is easy enough to do, and may give you an extra measure of comfort with the concern that you just expressed about virus coming back from school or back from home to school. Real easy to do.
That's very helpful. Thank you. We do have a few more questions coming in. One viewer asks, what are the symptoms in kids after they get affected to COVID-19?
What are the symptoms of COVID-19, in other words? All right, well, they're not much different than what you'd see in an adult. So it's fever in many cases, cough, shortness of breath. Sometimes in kids, you'll see more upper respiratory symptoms like nasal congestion, et cetera. Loss of taste and smell are very, I won't say unique, but very characteristic symptoms for COVID-19. So if your child or anybody reports that they've suddenly lost their sense of taste and smell and has other symptoms, boy, that's COVID until proven otherwise. But as you know, many children who get COVID are mildly ill, can be managed as an outpatient. We'll have to stay in isolation, of course, for the recommended period of time until they're asymptomatic and have met that time criteria. Now, having said that, we know that with the Delta variant, things have changed a little bit, and we've been a Delta state in Delaware for about 6 weeks now. Delta is much more transmissible, over 1,000 times as much virus in the respiratory secretions compared with the old coronavirus. As a result of many adults being vaccinated, the proportion of children who are getting Delta is greater. It used to be about 14 or 15%. Now kids are more like 20% of all COVID cases. And unfortunately, some kids are getting sicker. You've heard about other states. I mean, in Delaware, it really hasn't happened as much, but in Texas and in Louisiana and other places, children are being admitted to ICUs at rates not seen since January, or in some cases, not seen during the entire pandemic. So Delta is a force to be reckoned with. It's something we all need to take seriously, and it definitely is going to have an effect on children.
And Dr. Oren, if there are parents who think potentially it's COVID, potentially it's the flu, or it could be some other respiratory illness, when do they need to call their pediatrician and have that conversation?
I would say whenever they're concerned, I tell parents to trust their intuition, and if they have a hunch that something could be going on, please get us involved. And just like Dr. Epps said, just knowing that some of the most common symptoms of COVID are fevers, cough, shortness of breath, headache, sore throat. So if you're seeing any of those symptoms, the loss of smell, please give us a call.
Great. And thank you for those viewers to submit those questions. And if you have any other questions, please continue to submit them. We do have one more question that came in. How effective are face shields for kids and/or adults? Can they be worn in place of a mask?
So that's a good question. If you wear a face shield only, obviously it's not fitted to your face, and respiratory droplets can go over, under, and around a face shield. Now, they won't hit you directly head on, but they can still get to your respiratory tract and infect you. So I would say as a standalone mitigation to prevent somebody from getting sick, not as good as a face mask. Face masks are better. The one role of the face shield, though, is to protect your face mask. So wearing a mask and a shield together, which is often what we'll do here in the hospital, is a very effective strategy.
And as I mentioned, if you have any other questions, please continue to submit them. So, Dr. Epps, as parents continue to have concerns about their children or concerns about themselves and COVID, as we mentioned, it's super important to have all of the family members around these children vaccinated. So let's touch on that a little bit more. If parents are concerned or if parents are on the fence about being vaccinated, what would you tell them?
Well, I'm kind of a science-driven guy, so I would talk about the science. And what we know about the vaccines, as you know, with the original SARS coronavirus, it was 95% effective. If we're talking about the mRNA vaccines, the Pfizer and Moderna, and that's pretty darn good in the world of vaccines. With Delta, we know that things have changed a bit in many ways, but one thing is, even though these vaccines are still very good at preventing hospitalization and death, their overall protection is a little bit lower than that 95%. Having said that, if enough people get the vaccine, we will have a degree of protection in society that will benefit everyone. So, the science is there. Please, if you haven't had your vaccine or vaccines, go get them. It's for your own good. It's for the protection of your child. It's for the protection of your school and for the protection of society.
Absolutely. Dr. Oren, did you want to add anything?
I was just going to say, COVID itself is the main thing that we should be concerned about. The long-term effects. I've definitely seen many patients with months and months of symptoms from a prolonged chronic COVID syndrome. So all the uncertainties that you may have with the vaccine, I still think that does not outweigh the risks of what we're actually seeing with the COVID virus.
And if I could piggyback onto that, this happens in kids too. It's not just adults. I think adults have gotten more press, but kids, even with mild illness not requiring hospitalization, can get long COVID and have brain fog and breathing problems, et cetera, neurologic problems for weeks or months. So just a great reason to get your child vaccinated. And one day, and I'm hoping this will be late fall, early winter, we will have vaccines available for kids under 12. Once
Dr. Epps, I know you're not logged into the Facebook, but I think you already knew that was our next viewer question. Bruna asks, what about vaccine consideration for children under 12 and when is that coming? So you walked right into my next question.
All right, well, I am not part of any clinical trials involving children, and a lot of what I know is the same as what you can watch, what you can learn watching the news. But the trials there's different trials with different vaccine products, down to 5 years, down to 2 years, down to 6 months, some of the trials. So that's ongoing work. The data will come in, it will be examined by the FDA. In addition to looking at effectiveness of the vaccines and safety, we'll find out what the proper dose is, because we don't really know that at this point. And for the youngest children, it's likely, in my opinion, that it will be a different dose than what we're giving for people greater than 12 years of age. So as those data come in, as the FDA approves them, we will hopefully have approval and roll them out into use in the very near future. The American Academy of Pediatrics, one of my professional organizations, has been in communication with the FDA just to let them know, yes, we understand that you have to be thoughtful and careful and everything, but we are advocating for as speedy a rollout of the vaccine for children as can be done.
Great. And our next question, this may be our final question from the viewers. Jenny asks, what about safety on school buses for COVID?
Max, you want to take that one?
I would say social distancing if you can, and wear your mask is going to be the most important thing. So doing everything that we already talked about, hand hygiene, those are the most important things.
Yeah.
And Dr. Oren, is there anything else school bus related that you think parents should keep in mind?
I don't know if keeping the windows open would be helpful. I don't know if you have, yeah. That would be the other thing that I would suggest.
And face mask, face mask, face mask.
Yes, absolutely. So Dr. Oren, before we wrap up, is there anything else back to school related, separate and apart from COVID, that you think parents and families should be keeping in mind this year?
It would be the same things that I recommend every year. Kids are always in a stage where they're slowly developing, slowly learning to becoming more independent, and setting expectations and rules and for your children is an important thing to help them continue to grow and face the school year with success.
And I will mention for anyone watching, if you are in need of a pediatrician, Dr. Oren is currently accepting new patients at Christiana Care Primary Care at Concord. You can find his information in the comments below. Dr. Epps, final words on COVID.
So correct and consistent use of masks and get vaccinated.
Short and sweet, I love it. Dr. Epps, Dr. Oren, thank you so much for joining us today. If you are watching this after we're live or have questions you think of after watching us now, please submit those questions in the comments below, and we will continue to monitor those comments after we finish this live. Dr. Epps and Dr. Oren can always answer your questions later on. Thank you so much. Please stay safe and have a great afternoon.